be cautious if your physiotherapist is not tracking your progress, is not reassessing your case again and again, is not supervising you while you do exercises during the session.
Is 15 to 20 minutes of physiotherapy is enough? Or should it be 45 minutes or 1 hour or more than that? We get questions like this on a regular basis at Sakshyam. And if you ask me my opinion, it entirely depends on your condition. Namaste. I'm Dr. Alicia, a neurophysiotherapist, and I welcome you all to another video from Sakshyam Physiotherapy and Rehab. In this video, we will be explaining how much session time or treatment time is effective.
Let's break a common myth. So, there is no such universal rule that 20 minutes is basic, 30 minutes is standard, and 1 hour is a premium service. No, physiotherapy is not a packaged timing service. Physiotherapy is more of a clinical decision making. There are so many factors we have to remember before we decide the duration of the session, like the age of the patient, what are the functional goals of the patient, what is the stage of healing he is going through now, and what are the exercise tolerance capacity or the endurance level of the patient. So a structured progress matters more than the timing or the clock.
Conditions like stroke, Parkinson's disease, spinal cord injury, which comes under neuro rehabilitations, where we focus more on task-oriented activities or functional retraining, or balance and gait training. So they work on the principle of neuroplasticity. For them, 45 minutes to 1 hour of session is usually advisable because neuroplasticity works on the principle of maximum number of repetitions. But for geriatric patients, where the patients are presented with low endurance, multiple comorbidities, and often balance issues, for them longer duration sessions are not advisable because they have low endurance. So for them 30 to 45 minutes of sessions would be better, with slow progression and adequate amount of rest. And we have to keep in mind that a rest session can never help with neuroplasticity or brain rewiring. At the same time, an overloaded session will always exhaust elderly person. So what matters is safety, and quality always matters more than the duration of the session.
In early orthopedic pain phase, a 40 to 45 minutes of session may be enough because we have to reduce the pain and some activation exercises we have to do. But at the same time, if we are seeing a sports rehab case, minimum of 45 minutes to 75 minutes of session is required because in sports rehab, we have to focus on strength, agility, balance, and some sports specific retraining as well. So they need a bit of longer duration of the session because we are not only reducing the pain there, we are also preparing the body and mind to come back stronger.
In pediatric rehabilitation, where we mostly deal with developmental delays or motor milestone delay cases, the attention span matters very much. So here the sessions needs to be very much interactive and playful. So the ideal duration for pediatric cases would be 30 to 45 minutes, and the sessions should be playful and interactive. On the other hand, when we talk about cardiopulmonary rehabilitation, where we mostly deal with cases such as post-cardiac surgeries or COPD or post-COVID recovery, warm-up and cool-down are very much essential. And throughout the sessions, we need to monitor the vitals such as their heart rate and the oxygen levels need to be monitored. And the exercise intensity increases gradually. So the ideal session for all these cases would be 30 to 60 minutes, but again, the vitals plays an important role to decide the duration of the treatment.
See, there is no such magic number or any universal protocol to decide how many sessions are required or what will be the duration of session. A structured and right physiotherapy session will always produce some measurable and safe progress. And be cautious if your physiotherapist is not tracking your progress, is not reassessing your case again and again, is not supervising you while you do exercises during the session, and is only dependent on the passive modalities. So it's time for you to change your physio now.
The goal is not to finish your session quickly. The goal is functional recovery. And physiotherapy should always be personalized. It should not be standardized. If this video helped you understand physiotherapy and your physiotherapist better, keep following us for more physiotherapy and health related updates.